I started losing my hair in my 30s. When I found out there was another procedure known as FUE that would allow me to have a hair transplant without the 8-inch or so linear scar, I started looking into doctors that were performing FUE at the time. And I wanted to find a physician that was nationally board certified who did this for a living and did this every day. I wasn't interested in choosing a plastic surgeon who did other procedures and may have done a hair transplant 3 or 4 times a month. I wanted someone who concentrated on that as their profession and did this on a daily basis. I contacted Dr. Voorhees early in 2012, and we discussed the different procedures that were possible for me. We talked on the telephone, and we also did a WebMD consultation online where he could kind of visually see what my hair was looking like at that time. And after that conversation, we decided to schedule a consultation in his practice in Charleston to see if I would be a viable candidate for this procedure, FUE.
When we first saw Johnny, he was pretty much a Norwood 6, which meant that his hair loss extended from his hairline all the way to the back. These can be really challenging cases, especially for the crown. So what we decided to do was to recreate his hairline and what we call pack the frontal forelock, because that's aesthetically the most important area. There's an old adage in hair surgery that you forget the back. So we really wanted to concentrate in the front. But he wanted some grafting done in the back. His first session was around 5,200 grafts, and the way that we apportioned that was about 3,200 of the 5,200 were placed in the frontal forelock and the hairline, and then the remaining 2,000 was back in the crown.
After it was over, I saw the top of my head, and it was obvious where the grafts were placed, and I saw the little bumps and the little redness there, but I could see I had a really defined hairline for the first time in a long time, although these were just the initial grafts that had just recently been inserted. It was kind of exciting to me to see a new hairline in the future. And really, after about 10 days, 12 days, I was back at my golf club playing golf, and I didn't have a hat on, and some of the guys were saying, "Hey Johnny, why did you cut your hair so short?" They knew I'd cut my hair short, but they didn't know I'd had a hair transplant. I was amazed how fast that your scalp and your head heals. And the redness started going away. I felt no sensation or pain from that point on. And I was just anxious to see when the hair would start to grow. I knew it was going to take 3 or 4 months before it would start to grow. The hair would go through that dormancy phase, and mine did exactly how Dr. Voorhees told me it would do. After about 4 months, I started seeing small hairs percolating through my scalp, which was exciting to me and my wife, and we started taking some pictures of that. And I started a personal blog site so others could see that, and I started posting pictures as well on there. And so that was kind of exciting about that 4-month period where I started to see real growth and started the formation of a new hairline.
Well, after Johnny's first procedure, we had the opportunity to present him down in the Bahamas at the ISHRS conference. He was only a month or 2 after his procedure, so that's way too early to assess growth. But we wanted to present him because I wanted other doctors to look at his donor area, in particular how rapid the donor area healed and how it was totally pristine just after a month or so. And so when we presented him down at the Bahama conference, a lot of doctors came up, looked at his donor hair. I told them up front with photos that this was not a completed case because we're only like a month or 2 after the procedure, but they were wowed by how well his donor responded and that there was no evidence of scarring. I mean, we get into this issue of scarring, and of course anything that pierces the skin can cause a scar. The issue, is it visible? I mean, most people's definition of scarring is it a visible scar? And what they saw just after a month after surgery is there was no visible scar.
Really, after about 6 to 9 months out, my hair really started to grow. All of my donor area hair grew in very quickly, and that was, you couldn't even tell anything had been taken from the donor areas after a short amount of time. But the hair was really growing in 9 or 10 months later, and then I would run into people that I hadn't seen for quite some time, and they knew I was retired, so they said, "Man, Johnny, your retirement's looking good on you. You've really gotten in shape, and you're looking good these days." They really couldn't put their finger on it, that it was really the fact that I was getting more hair that was making me look better, in shape, and certainly younger. After my first procedure, and I had started my blog, and I kept that going for the next couple of years, and I would post pictures periodically, at least every week or two, on there. And there was an area that I noticed that I wish I'd had a little more density in, and I wanted to kind of thicken it up a little bit in the front, possibly. So I contacted Dr. Voorhees, and we talked about the possibility of doing that.
We decided to do an additional 2,000 graft case, packing into the frontal forelock. Because that gave a total of 7,200 grafts, we were a little concerned about over-harvesting the donor. FUE is always subject to over-harvesting, so you do have to be careful never to do that. It's something that we always look at first, is don't destroy the donor. And so we did 2,000 grafts into the frontal forelock, and I was amazed how well his donor responded. And we see that occasionally, but Johnny was obviously a bigger case than what we normally do in our clinic.
2 years after I participated in the international conference with Dr. Voorhees in the Bahamas, he invited me to come to the Chicago International Convention, where the same surgeons would be there, and it'd be a good time for some of them who remembered seeing me in the Bahamas 2 years prior to see the real extent of the growth at that time.
So 2 years later, we went to Chicago so that we could actually exhibit Johnny's full growth after the procedures. And what we saw was that he had excellent growth after the 2 procedures, and doctors came and looked at Johnny, combed through his hair, and they were wowed by how great his hair growth was and how well his donor area looked.
At the Chicago conference, I recognized a number of the same surgeons that I'd spoken with in the Bahamas. They were really amazed at how well my donor areas had responded. In fact, several of them came up to me and said, "You know, you've got plenty of hair left in your donor area. You could do another procedure if you wanted." I had little interest in doing that at the time, but it was nice to hear that they thought I could even handle another procedure.
Several doctors came up and said it was the highlight of the live patient viewing session, because we were actually showing an FUE case that actually grew out everything and showed how the donor responded. At the conference, we got a lot of requests after they looked at Johnny and saw both his recipient and donor area, and they wanted to know how this was done. I had several doctors, very prominent doctors, want me to videotape my procedure so they could see exactly how the procedure was performed. And since the conference, we've had at least 6, maybe 7 doctors who actually flew into Charlotte just so they can sit on the surgery. We always have an open door policy. The doctors can come and do that. And we're always happy to show how our procedure is done. We're very open about that.